Hello, my name is Rodrigo Barbosa Lima, and I'm from Florianópolis, and I belong to a PhD program of the Federal University of Santa Catarina. I present to you a clinical case with the theme Digital Workflow, Accuracy and Predictable Solutions. This is a case in which a 90-year-old male patient came to our private clinic after suffering a bike accident. He had mobility and incisal fractures of the maxillary central incisor and avulsion of the maxillary left lateral incisor. The lateral incisor was lost, and so was the buccal bone plate. The patient underwent clinical examination, complete anamnesis, CT scan, intraoral scan, and presented favorable conditions for surgery. We started with local anesthesia, a slightly palatally displaced incision, total detachment, and fully guided milling. Used the Implant Guide system from Implant. Precise milling was required due to a nearby bone fractures resulting from the trauma and the compromise of the buccal wall. The implant of choice was a 3.5 by 11 Maestro from Implant as well, a Brazilian company. The bone regeneration was performed with chenogenous graft. Extra graft, we opted for a primary closure and provisional adhesive restorations. The guide was planned using the available library of the Maestro implant through Exocad software. Impression settings were programmed by Chitubox software for the Flash Ford Hunter printed. The resin of choice was DD Guide from Printax. After the osseointegration period, reopening was performed, associated with subepithelial connective tissue grafting, abutment insertion, scanning, milling, and installation of a screw retain provisional. All this in the same session. Respecting the soft tissue maturation time, the restorations were finalized and the definitive ceramic crown was installed. And as you can see, considering the indications and limitations of guided surgery, they allow us formidable and predictable results. Thank you for your attention.